Morning, morning, morning. Good morning. Good morning to you.
We have with us the manager of the NCSA, Ms. Betty Hunt, along with Laura Foster, the Research and Information Officer. Good morning to you, ladies.
Good morning.
Good
Thank you for having
morning.
us.
Yes, it's a pleasure. Now, we are talking about Drug Awareness Month, and there's so many things NCSA has been doing. But right now, you ladies are here to talk about your Give Back program and your food drive that's going to be happening coming up shortly. Has this always been a part of the activities for the month?
Well, no, it hasn't. What we found is during COVID, a lot of our clients were doubly disadvantaged. As you know, a lot of our clients are already marginalized. And so we thought we would reach out to help those clients during COVID. And it has grown. We started with about 7 clients, and now we try to assist at least 50 families. So that is our Give Back program. In addition to that, we try to expand, and so during the month of January, we do an extra special food drive where we reach out to the community. We go at several supermarkets. Laura spearheads that drive, and perhaps she can speak some more to that.
Yes.
And that is how we try to supplement what we have to assist not only our direct clients, but families who may be impacted by drug abuse, who are not our day-to-day clients.
Okay.
Yes.
All right. So it's over to you now, Laura. How has this collection drive been going?
So this is our second year. We decided to do that last year for the first time, and we had a tremendous response from the community. Last year we were at 3 Massey locations, so we're doing a similar approach this year. Again, we're going to be at Massey Warrens, Massey Worthing, and Massey Sunset Crest this Saturday, so the 27th from 9 to 4. And we focus a lot on non-perishable items, so things that we can put into our hampers. And then we also have the option for persons who may want to make a monetary donation instead.
Okay, and then you can utilize that to purchase whatever other items
Correct.
the family may need.
Correct.
Okay. Now, in terms of the number, you mentioned that it's 50 families. Are you sticking at that number, or do you expect that more may come along in terms of people who may have been in your programs, and that might spread the word to others who, as you said, are afraid to come forward because of that whole stigma, marginalization?
Well, you hit the nail on the head, and this is why we try to help wherever we can. So we've set 50 as a baseline, but we find whenever we go out, there's always somebody that we meet on the outside. We try to do a slight means testing, knowing, of course, that, as you said, with drug abuse and people are highly stigmatized, sometimes we may not get all the information. But to answer your question directly, yes, we do consider persons other than those 50 persons. As long as we have the means, we will consider helping, and we will certainly assist. And our food drive has expanded not only food, but basic items of clothing as well. Okay. And so we welcome good donations, lightly used, previously loved donations, and we include those as well.
Okay, well, that's nice. Now, to you, Laura, your job at NCSA is that of research. What are some of the areas that you've been helping to uncover, and how important is it in terms of the policy and programs that Ms. Hunt then has to map out?
So I'll start with your second question first. So the importance of research for the NCSA, and really Barbados on a whole, all of our policy makers, practitioners in the field. Research goes a long way towards what we call an evidence-based approach, which really is the gold standard in today's world. So gone are the days where we would do things based on how we feel or what we think may be the issue. Through research, we're able to actually uncover what the issues really are, and then we can design targeted interventions, targeted approaches that will truly tackle those. So that's how research is important, that we know we're getting to the meat of the matter and really putting things in place that should and will work. And then we can come on the back end and use the research again to check and find out, did it actually do what we intended it to do? So research really is quite a powerful tool.
Okay.
In terms of the topics, we look at a range of things. So we look at the broad drug situation in Barbados. So what are the prevalence rates for drug use? We also look at, certain populations. Is drug use higher in certain subgroups? So we will look at school students. We also look at activities that are happening within our prevention and our treatment, as well as our supply control sectors as well. So we look at a broad range of things.
Okay. Now back to you, Ms. Hunt. In terms of NCSA, there's a lot of policy to be set in terms of dealing with these individuals, because it's not just about coming, getting treatment and leaving. We also have to make sure that these individuals are protected in terms of privacy issues, protected in terms of if matters need to be sent further forward in terms of court, counseling, other agencies you have to interact with. How difficult is it for you as the head at NCSA to be able to get others to comply with the policy initiatives and directives which you have on board?
It has been challenging, but I must say that it has gotten better. As you quite rightly stated, this whole issue of a response to drug use is multifaceted, and so it needs an interagency approach. What we have done in the past is that some of our key stakeholders have come on board with us. They have signed MOUs in order that we get the information which Laura just referred to in a timely manner. Sometimes that has worked, sometimes it hasn't. But what we need is a coordinated approach, because without that coordinated approach, you will find individuals either falling through the cracks. Some persons may be benefiting from several agencies in a way that disadvantages others because resources are few. And so this is something that we have set as a policy initiative going forward to see how we can concretize those relationships in order that clients and persons who are impacted by substance abuse do not feel the stigma in going forward. Because you're right, it is a stigma that is not a stigma like other types of diseases. And so we find in doing that, again, as a policy initiative, we are now trying to steer the conversation away from drug use as only a criminal justice issue to seeing it as a public health approach. In that way, we can encourage more persons not only to step forward, but those in related fields to treat to persons with substance abuse as they would treat to any other public health issue.
Okay, so then there's generally a fair amount, some of the users and abusers, that if I do step forward, I'm going to end up before the court.
It is that. It is also a social stigma. Drug use carries a heavier social stigma than a lot of other, let's say, social ills. And so it is not only the individual, the family is impacted as well, because a lot of the times what we don't realize and what we don't consider is that families suffer in the same way as the individual user.
They suffer doubly.
Exactly.
Because they suffer by not having that matriarch or patriarch in the household, and then they also suffer from the things that people are impacting on them in terms of what is going to be said, within the communities in which they live.
And that is true, because substance use is often seen as a moral failing, and so people are very heavily judged when their family members are impacted by substance use. And what we have come to realize with science, with research, is that there comes a point in time in your substance use when you're a problematic user that the structure of your brain changes. And so a lot of times it is very difficult for someone who is in rehab. This is why we say we are constantly in rehab, to just be in rehab and, as you said, be counseled and be over. We have to make ourselves prepared for when that person relapses, because it happens. You relapse and you start
don't want
again.
it to happen,
Right.
but it will.
It will happen. It can happen, and so we have to be prepared and not see it as a failure. And this is why we need the buying of other social agencies, and this is why we need the buying of the public. And so what we have done is we have restarted our public education. And again, this is where our research comes in. When we do our research, and they come back to us and say, this is what is happening. And not only this is what is happening, these are the trends that we are seeing. And those trends help us prepare and get in front of what may be coming. And so we are able then to tailor our programs to get ahead of the curve. Because as you know, policy takes a while sometimes to go through,
Yes.
right?
And so system, it does.
Correct. So once we have the research that is saying these are the trends, then we can sort of get ahead while the policies in the background trying to catch
be
up.
worked on.
Correct.
Yeah.
Correct.
Now, Laura, for you, first of all, what is BARDIN?
So that's our Barbados Drug Information Network. And what that does is it gives us almost a snapshot of what is happening in our drug situation. So each year we will collect data for a calendar year from January to December, and we look at activities within prevention, so what we do at the NCSA, what the treatment centers are doing. We also look at, as what I would have said before, the supply control sector. So we look at the police, the prison, those sorts of agencies, so that we can get an idea what everyone is doing towards preventing drug use and the supply of drugs in the society.
Okay, and now that you've looked at that snapshot from 2023, are we all on the same page?
I would say, based on our data that's coming out, the drug situation remains very much the same. One thing about us, we're pretty consistent year after year. And you are seeing quite a similarity between what's happening in treatment and what's happening in supply control. But what we have noticed in recent years is we're starting to see some non-traditional substances creep in. So while we are primarily a society which sees persons seeking treatment for things like alcohol and marijuana and cocaine, and likewise, the police are mainly seizing marijuana and cocaine. We're starting to see some things pop up. So things like a little bit of methamphetamine, a little bit of ecstasy, those sorts of things. So those would be the trends, those emerging things that Mrs. Hunt was speaking about that we need to get ahead of.
Okay, and in terms of policy for 2024, have you found that there were gaps or a few weak points that you wanted to tweak in terms of being able to more effectively deliver your programming that you may be putting forward for this year?
Yes, and I think you hit the nail on the head at the outset. It really requires some mechanism for reporting, this interagency reporting, based on our boarding and our setup with our Barbados Drug Information Network. We've been able to craft a committee, as it were, for an early warning system that has plugged a hole.
We hear early warning mostly with hurricanes,
Yes, with
so
hurricanes.
I'm excited to understand how I'm going to be warned about this now.
Again, actually, we had 2 alerts issued last year. What the early warning system does, and again, this is a creature of research, so if I'm speaking out of turn, I'm sure Laura will correct me. But basically, in a nutshell, what the early warning system does, it is made up of key stakeholders. So one of our key stakeholders on that early warning system is the Forensic Sciences Center. And so it is more than this is a substance it looks like. Once we are aware of a substance, once we have a sample of that substance, it is sent for testing at laboratory. When they confirm what the substance is, and it is a new emerging substance, it's a new psychoactive substance, that is the term, NPS, then the committee determines there is a setup. Is this, what level of warning should we give to the public? Is this something that everybody needs to know? Is this something we keep our eyes on? And so last year, we had 2 instances where it was agreed that this is something that we should share with the public. And once that decision is made, then our minister shares that information from the highest level. And so to me, it creates a sense of seriousness, the sense of awareness of what is out there. And so that early warning system, although it is in its infancy, has proven valuable. And we hope to be able, we encourage members of the public where there are substances that they're not aware of. Certainly this is how we came into a possession, because of aware members of the public who were concerned, but we always send them for testing. And it is as a result of the testing that the early warning system mechanism kicks in.
This is now where your policy comes in,
Yes.
because if I want to help Laura do her job in terms of researching these new substances, and I decide I'm going to bring something that I came across in some form or fashion to NCSA so it could safeguard others, so they don't fall amok of what I may have experienced from the substance. My first concern is going to be, are they going to call the cops on me for bringing this thing to their attention?
Well, we had this discussion, I'm sure Laura will speak some more about this, but we had this discussion at the release of one of these alerts. And how do we make the public feel comfortable? And there's a fine line between that and contravening any laws with respect to possession or so. And so that is being worked out, but certainly members of the public can take the substance directly to the Forensic Sciences Service Sciences Center as well, and they too, they too will accommodate. And so we're now in the process of trying to put into policy what can be done, what is happening now is practice. Right? And as Laura mentioned, we've moved our research from the back end, and we have adopted an approach from research to policy to practice. So they do the research, we see where the policy has the gaps, we see where the policy speaks to what is happening, and then our practice and our programming moves from there.
All right. Well, ladies, I'm going to wish you well in your food drive come this weekend at the Massey stores. I want to thank you so much for coming. Betty Hunt, the manager of the NCSA, and Laura Foster, the research and information officer there. We thank them for coming on the program, and we're glad they have that early warning system to keep us all in the know.
Morning, morning, morning. Good morning.